Wel, 2 wythnos yn ôl, fe wnes I adael fy swyddfa yn Rhy Hywel, ger y Synedd, a gwneud fy ffordd I lawr I brif neuadd y Cynhadledd. Ro'n I ar y pryd rhwng amryw o ddigwyddiadau gwahanol, a fy meddwl yn neidio o un peth i'r llall. Yn meddwl am gyfarfod y ges i'r bwrw hwnnw gyda criw o seicolegwyr ar gweithlu iechyd perthynol, a sut oeddwn I am ymgorffori gofynion nhw mewn I raglen llywodraeth. Yna oeddwn i'n meddwl am fireinio Araith ar gyfer y prynhawn yn y Senedd a sawl peth arall yr un pryd. Ac yng nghanol hyn I gyd, roedd angen I mi fynd I gyfarfod Abertawe a siarad yno ac yn bwysicach fydd gwrando ar rhai o'r plant a phobl ifanc oedd wedi cael I bywydau wedi cael I gyfoethogi oherwydd ymyraeth yr elusen arbennig honno. Yn anffodus, roedd rhaid torri'r ymweliad yn ei flas oherwydd cyfyngder amser ac wrth fynd at y siambr, fyddais I ar draws mam ifanc a 2 fab, ac mae stori nhw yn crynhoi gymaint o'r hyn sydd wedi mynd o'i le a'r her sydd o'n blaenau ni, os y gawn ni y fraint o fynd mewn I lywodraeth. Roedd y bechgyn yn fechgyn ofnadw o annwyl, yn serchog, yn siaradus, gyda un newydd ddechrau yn yr ysgol uwchradd a'r llall yn parhau yn yr ysgol gynradd. Ond oedd y 2 ohonyn nhw ddim yn arwain plentyndod cyffredin, oherwydd roedd y 2 ohonyn nhw'n ofalwyr i'w mham. Bob bore, oedden nhw'n gorfod codi a pharatoi brecwast a gofalu am ei mham. Ac ar ôl dod adre, roedd nhw'n gorfod paratoi swper eto, tacluso a gofalu'n dyner unwaith eto am ei mham mwyn iddi fynd i'r gwely. Yn yr ychydig o amser hamdden oedd ganddyn nhw roedd y 2 yn licio chwarae rygbi a darllen. Ac roedd y fam druan yn dioddau o sawl cyflwr iechyd. Oll y tu hwnt yw rheolaeth hi ac yn methu felly a gweithio oherwydd ei anhwylderau. Ond yn waith fyth, roedd hi wedi bod ar restr aros am sawl triniaeth, nid am fusoedd, ond am flynyddoedd. Ac mewn un achos, roedd hi ar restr am dros 4 blynedd. Yn ogystal â hyn, roedd ganddi gynllun iechyd arbenigol wedi cael ei lunio ar gyfer un o'i hanhwylderau, oedd yn golygu bod rhaid I gael check-up bob 3 mis yn yr ysbyty. Oedd y cyfarfod yma 2 bythefnos yn ôl yn iawn. Doedd ddim wedi cael check-up ers mis Rhagfyr. Yr hyn sy'n gwneud I stori nhw yn hyd yn oed fwy trist ydy nad ydy o'n unigryw. Yn wir, mae'n llawer iawn rhy gyffredin. These boys were doing extraordinary work, driven by love and a sense of duty and compassion. And without Barnados and other third sector providers, they'd be all at sea. It's clear that we need to improve support for our carers here in Wales, both kinship and unpaid. And the mother, seemingly on a constant waiting list, waiting to be relieved of her pain. Right now, 1/6 of our entire population are marooned in the limbo of not knowing when they'll be seen for treatment, with some having suffered in discomfort, pain and anxiety for many, many years. Meanwhile, Labour's propensity for dealing in false dawns and shifting goalposts on performance targets knows no bounds. And this vast backlog isn't just a scandal in and of itself. The sorry legacy of a government whose tired complacency, enfeebled authority, and a distinct unseriousness becomes ever more glaring with each passing day. It's also a symptom of a health system whose components are not functioning in the way they should. From the long queues of ambulances left stranded outside A&E departments, to the alarming normalisation of unsafe corridor care, from delayed hospital discharges to failing standards on cancer treatment. All too often, for far, far too many people, pathways of care are beset with pitfalls, obstacles and uncertainty, rather than being the timely, uncomplicated and transparent journeys that they should be as a prerequisite in a 21st century healthcare. Where once there was a well-oiled machine, the envy of the world and the pride of our nation, we now have an NHS that is disjointed and damaged, that splutters, strains and stalls under ever-escalating demand and a complete lack of direction from a rudderless government, with dedicated, hard-working staff with their morale at an all-time low under severe stresses. Nowhere is Labour's chronic neglect of the machinery of our precious health service more apparent than in primary care. Our GP services account for 90% of patient contact. In a very real sense, they are what makes the NHS tick. But the extent of their engagement stands in marked contrast with the paucity of resources at their disposal. Over recent years, the proportion of the Welsh health budget allocated to general medical services has shrunk to around 6%. It's little wonder, therefore, that the number of GP practices in Wales has decreased by 27% in the last 2 decades and by 7% in the years since the pandemic alone. And for those that remain, an intolerable workloads, now compounded by hikes to national insurance, rent increases or crippling PFI contracts, and Labour's failure to deliver on promises of cheaper energy bills. They've become a looming and ever-present reality. The inevitable consequence is that this first line of defence in the NHS is being overwhelmed, with systematic early intervention becoming increasingly elusive and the misalignment of referrals further clogging an already congested system. Conference, make no mistake, this indispensable arm of the health service is being stretched to breaking point. And this is why we must make it a burning ambition of ours to restore the shattered foundations of primary care. This will necessarily require a long-term process of renewal, straddling multiple Cynhadledd terms. It means plotting a sustainable shift in resources from secondary care to primary care, replenishing the share of general medical services within the overall health budget to at least 8.7%, with the aim of eventually reaching 11%. It means retaining a far higher proportion of staff, reversing the all too familiar tale of great talent being nurtured here in Wales, but not being effectively reinvested for the benefit of our communities. It means reviewing the funding formula, the Cahill formula, which currently undervalues the work of general practice and is especially disadvantageous for surgeries based in more deprived areas. It means ensuring that the operational costs of running a GP practice are not so prohibitive as to disincentivize the talent of the future from choosing to work here in Wales, as is so often the case presently. And it means creating 500 additional GPs to bring us closer to the OECD average for workforce capacity in primary care. But Conference, as much as we understand the importance of having this long-term vision, we must also be keenly aware that the patience of the Welsh public has, understandably, worn very thin. Many simply can't wait any longer, and far too many have passed away while waiting for their treatment. Cleaning up the dreadful mess that Labour has made of waiting lists must be a priority, because thousands of people are in pain right now. And we must be the ones to provide the relief that they crave without hesitation and without excuses. That's why a Plaid Cymru government will invest in innovative programmes to tackle the waiting list co-designed by clinicians and healthcare providers to finally make sustained and substantial headway in reducing the NHS backlog. It will consist of bespoke funding to establish 6 new elective care hubs across Wales, which will deliver an industrial-scale approach to high-volume, low-complexity treatment and become centres of excellence for long undervalued specialisms such as ophthalmology. It will also include further resourcing to enhance bed capacity, directly addressing the shameful preponderance of corridor care, which has seen countless patients suffer the indignity and the danger of receiving treatment in inappropriate settings, such as chairs, the back of ambulances, or even on floors. And unlike Labour, we recognise that primary care must play an active role in the solution, rather than being sidelined as a result of blinkered firefighting exercises that have become emblematic of this government's fiscal profligacy and strategic incoherence. This is why a Plaid Cymru government, as a first step in a long-term process of renewal in primary care, will provide funding to support the further rollout of telemedicine services for GP practices and the services provided from many health centres, such as podiatry and other therapists, thereby easing administrative burdens for practices and re-energising that vital relationship with their patients. Cynhadledd, fel dwi wedi ddeud sawl gwaith o'r blaen, mae'r broses o drwsio a gwella ein gwasanaeth iechyd ar ôl iddi ddioddau dros chwarter canrif o ddiffyg arweiniad a chamreoli yn mynd i gymryd mwy na lluchio pres at y broblem. Mae'r ffaith fod y Llywodraeth lafur yma wedi gwario 1.5 biliwn o bunnoedd mwyn trio mynd i'r afel ar rhestrau aros dros y 4 mlynedd ddiwethaf yn unig, a'r rhestrau aros yna wedi cynyddu o 200,000 yn dangos nad pres ydy'r unig ddatrysiad. Ond beth sydd hefyd yn berffaith amlwg ydy na ellir dadcysylltu yr her anferthol o ail-adeiladu ein sector gofal cynradd oddi wrth yr her argyfyngus o drio mynd i'r afel ar rhestrau aros hirfaith. Mae'r ddau beth ynghlwm ei gilydd. Does gen I ddim amheuaeth. Mae'r rhan allweddol o'r datrysiad ydy grymuso ein meddygon teulu a'r gweithlu yn ein meddygfeydd fel y rheng flaen, nid yn unig wrth adnabod clefydau, ond wrth atal pobl rhag mynd yn sâl yn y lle cyntaf. Yr hyra yma'n rhaid I bobl aros am driniaeth, y mwyaf tebygol maen nhw am droi eu cefn ar ein gwasanaeth iechyd genedlaethol a chwilio am ddatrysiad preifat, neu yn achos y mwyafrif difreintiedig yn gorfod byw mewn poen neu ffindio ffordd I hunain o drin y clefyd a cholli pob urddas yn y broses. Dyna beth fydd gwaddol Llafur Cymru wrth iddyn nhw gamu lawr o'r 5 llawr yn Nhŷ Hywel y flwyddyn nesaf. Plaid a Neirin Befan yng Nghymru wedi agor y drws I gwmnïau preifat elwa ar ddioddefaint rhai o bobl tlotaf a mwyaf difreintiedig gogledd Ewrop, gan dan seilio ein gwasanaeth iechyd a galluogi pleidiau gwleidyddol eraill sydd gyda agenda tywych a pheryglus I ddadlau dros ddatgymalu ein gwasanaeth iechyd. Cynhadledd, dim ond ychydig fusoedd sydd I fynd tan ein hetholiad cyffredinol nesaf. Etholiad fydd yn ail ddiffinio ein gwasanaeth iechyd a'n cenedl. Etholiad fydd yn gosod y cywair am genhedlaeth gyfan ac i'r cannoedd o filoedd o bobl sydd ar restrau aros yn aniall yr etholiad yna ddod yn ddigon buan. Mi all pobl bleidleisio dros Blaid Cymru yn gwbl hyderus y bydd yma wasanaeth iechyd fydd yn parhau am ddim, yno yn ystod ei horiau mwyaf anghennus ac yno i'w helpu I fyw yn iach. Oherwydd, o dan Blaid Cymru gall pobl ddisgwyl byw yn hyrach ac byw yn iachach, gan dderbyn y gofal maen nhw ei angen pam mae ei angen arnyn nhw. Gyda gwasanaeth iechyd fydd yn byw I fyny i'w delfrydau gwreiddiol, sef atal, adnabod a thrin. Dyna ydy'r dyfodol o dan Blaid Cymru, dyna'n gweledigaeth a dyna y bydd Plaid Cymru yn ei gyflawni. Diolch yn fawr iawn.